Right now, there are bacteria inside your body that could kill you without any warning at all. Some bacteria can destroy your organs in just hours, faster than your body can fight back. And the most terrifying part, you won't feel anything until it's already too late to stop it. A tiny cut on your skin might be all it takes for something deadly to enter your body unnoticed. Some bacteria don't just infect you, they slowly begin destroying your flesh from the inside. This condition is known as flesh-eating bacteria, and it progresses faster than most people expect. At first, it may feel like a normal irritation, something you might ignore without thinking twice. But within hours, the pain becomes intense, far worse than what the surface shows. The bacteria begin attacking soft tissue, cutting off blood supply and killing cells rapidly. As the tissue dies, toxins spread through the body, making the condition even more dangerous. Swelling appears quickly, followed by discoloration that signals something is seriously wrong. Many victims describe the pain as unbearable, even before visible damage becomes obvious. This is what makes it so dangerous. The infection spreads faster than most people react. In some cases, bacteria can enter through something as small as a tiny scratch you barely even notice. Once inside, they begin multiplying rapidly, spreading through nearby areas before your body reacts. Your immune system tries to respond, but sometimes it cannot keep up with the speed of the infection. As the infection progresses, the affected area begins to lose normal function without obvious warning signs. At this stage, symptoms may still appear mild, making it easy for people to underestimate the danger. But internally, the spread continues, affecting deeper layers and moving toward more critical systems. Once it reaches the bloodstream, the risk increases significantly as it can travel throughout the body. This can trigger a widespread reaction that affects multiple organs at the same time very quickly. In severe situations, the body becomes overwhelmed, and systems begin to shut down under pressure. Without immediate medical intervention, the condition can escalate beyond control in a very short time. Doctors often rely on early signs, but these infections can appear normal before suddenly becoming severe. In many real cases, people delay seeking help because the symptoms seem minor at first glance. By the time the condition is recognized, the infection may have already spread beyond the initial area. This rapid progression is what makes these bacteria especially dangerous compared to many other infections. Understanding how quickly things can change is the key to recognizing the seriousness of these infections early. When patients finally arrive at the hospital, doctors must quickly assess how far the infection has progressed. Medical teams often run tests immediately to determine the type of bacteria and how aggressive it is. Time becomes the most critical factor, as every hour can allow the infection to spread further inside the body. In serious cases, doctors may decide to remove affected areas to prevent the infection from spreading. Even with treatment, recovery can be difficult, and the body may take a long time to return to normal. In some cases, patients require multiple treatments, as the infection may continue even after initial care. Doctors must monitor the patient closely, watching for any signs that the infection is returning or worsening. Even after visible symptoms improve, hidden effects inside the body may still take time to fully recover. Some patients experience long-term effects, depending on how early the infection was treated and controlled. This is why early recognition and fast response remain the most important factors in preventing severe outcomes. In some situations, the infection damages tissues so severely that full recovery is no longer possible. Patients may lose strength or function in certain areas, depending on how much damage occurred during infection. Rehabilitation can take months, requiring consistent effort to regain even basic physical abilities again. Even then, some patients never fully return to their previous condition before the infection happened. This lasting impact shows how dangerous these infections are. Even when the patient survives the initial stage, this lasting impact shows how dangerous these infections are. Even when the patient survives the initial stage, what makes these infections truly dangerous is how easily they can begin without any obvious warning signs. Because the early symptoms seem harmless, many people continue their daily routine without realizing the risk. By the time the danger becomes clear, the infection may already be affecting critical parts of the body. This delay in recognition is what turns a manageable situation into something much more difficult to control. In many cases, the difference between recovery and serious damage comes down to how quickly action is taken. Even a few hours can change the outcome completely, turning a small issue into something life-threatening. What begins as something invisible can quickly become a condition that affects your entire body. And by the time you realize what is happening, the situation may already be far beyond your control. Some of the most dangerous threats are the ones you never notice until it is already too late. Not all bacteria can be treated easily. Some have developed resistance that makes them far more dangerous. These are known as antibiotic-resistant bacteria, and they are becoming more common in hospitals worldwide. One of the most well-known examples is MRSA, a type of bacteria that can survive many standard treatments. MRSA infections can begin just like any other, often starting from small cuts or simple contact with surfaces. But what makes it different is how difficult it becomes to stop once the infection has started spreading. MRSA is often found in places where many people come into close contact with shared surfaces every day. Hospitals are one of the most common locations, where weakened immune systems make patients more vulnerable. But it is not limited to hospitals. MRSA can also spread in gyms, schools, and other public spaces. Simple contact, like touching contaminated surfaces, can transfer bacteria without you even realizing it. Once transferred, the bacteria can enter the body through small openings and begin the infection process again. After entering the body, MRSA begins multiplying at the entry point, expanding quickly before spreading deeper. As it grows, the infection starts pushing into nearby tissue, increasing the affected area step by step. At this stage, treatment may already begin, but MRSA does not respond like most common infections. Instead of slowing down, the bacteria continue spreading, moving deeper into the body despite ongoing treatment. If it reaches the bloodstream, the infection can rapidly travel to multiple areas, making it much harder to control. As the bacteria spreads through the bloodstream, multiple areas of the body can become affected at the same time. This makes treatment far more complex, as doctors must try to control the infection in several areas at once. Because MRSA resists many antibiotics, doctors often need stronger or more targeted treatments to slow it down. Even then, the infection may continue progressing, especially if it is not detected and treated early enough. This is what makes MRSA one of the most serious bacterial threats. Combining rapid spread with strong resistance. When infections like MRSA spread too far, the body can enter a dangerous condition known as sepsis. Sepsis is not just an infection. It is the body's extreme response that begins to damage its own tissues. Instead of fighting the infection normally, the immune system starts affecting healthy areas as well. This reaction can disrupt normal functions, including circulation, oxygen delivery, and organ activity. As these systems begin to fail, the situation can become life-threatening in a very short period of time. One of the first systems affected is circulation, where blood flow becomes unstable and less effective. As circulation weakens, oxygen delivery drops, causing vital organs to receive less support than they need. The heart begins working harder to compensate, but over time this added strain can lead to further complications. At the same time, organs like the kidneys may begin to lose function as the imbalance continues to worsen. This chain reaction can quickly affect multiple systems, pushing the body closer to a critical condition. As the condition worsens, blood pressure can begin to drop, reducing the ability to maintain stable circulation. With less pressure, blood struggles to reach vital organs, further increasing the risk of system failure. The brain may begin to receive less oxygen, affecting awareness, response, and overall body coordination. At this stage, the body is no longer able to regulate itself properly, and multiple systems begin failing together. Medical intervention becomes extremely urgent, as every moment without stabilization increases the danger. Doctors may use advanced support systems to maintain circulation, breathing, and organ function temporarily. However, these measures do not stop the underlying problem, which continues to affect the body internally. If the condition continues to progress, the body may reach a point where recovery becomes extremely difficult. At this point, multiple organs may no longer function properly, making survival dependent on immediate action. This is the most critical stage, where the body can no longer maintain balance without external intervention. But not all deadly infections spread this fast. Some can stay hidden inside the body for months before showing signs. These bacteria can remain inactive inside the lungs, without causing noticeable symptoms for a long time. During this period, a person may feel completely normal, unaware that an infection is already present. Over time, the bacteria begin to activate, slowly damaging lung tissue and affecting breathing function. Unlike fast infections, this process can take weeks or even months before symptoms become noticeable. After remaining inactive for long periods, the bacteria can begin activating and slowly affect lung function. As the bacteria spread, small areas of lung tissue become less effective at exchanging oxygen properly. This gradual damage often goes unnoticed, as the body adapts and continues functioning despite reduced efficiency. Over time, the damage increases, eventually reaching a point where symptoms begin to appear more clearly. At this stage, signs like persistent coughing and fatigue begin to develop as the lungs struggle to keep up. As the infection continues, coughing becomes more frequent and harder to ignore during daily activities. Breathing may feel slightly restricted, especially during movement. As lung efficiency continues to decline, the body begins losing energy more quickly, making simple tasks feel more exhausting than before. At this point, symptoms are noticeable, but they may still be mistaken for less serious conditions or fatigue. This delay in recognizing the cause allows the infection to continue progressing without proper treatment. As the infection continues, coughing may last longer and happen more frequently throughout the day. The body begins to lose weight gradually. As energy is constantly used to fight the ongoing infection, fatigue becomes more constant, making it difficult to maintain normal routines without frequent rest. The infection continues affecting lung function, further reducing oxygen intake and overall physical performance. At this stage, the condition is no longer mild, and the infection is actively impacting the body every day. When an infected person coughs, tiny particles containing bacteria are released into the air around them. These particles can remain suspended in the air for a period of time, especially in enclosed spaces. When another person breathes in the same air, the bacteria can enter their lungs without direct contact. This means transmission can happen simply by sharing the same environment, even without physical interaction. In crowded or poorly ventilated areas, the risk of transmission increases as more particles accumulate over time. In places like buses or trains, people share the same air for extended periods of time in close proximity. If one person is infected, the bacteria can spread through the air and reach others without direct contact. Indoor environments with limited ventilation allow these particles to remain in the air longer than usual. This includes places like classrooms, offices, or waiting areas where people stay for long durations together. The longer people remain in these shared spaces, the higher the chance that bacteria can be inhaled. Treating tuberculosis requires a long-term approach, often involving multiple medications taken over several months. Unlike shorter infections, stopping treatment early can allow the bacteria to remain and continue developing. This makes consistency critical, as incomplete treatment can lead to stronger and more resistant forms of infection. Some people may find it difficult to follow long treatment plans, especially when symptoms begin to improve. This gap between feeling better and being fully treated allows the infection to return and continue causing damage. Even after treatment, the lungs may not fully recover, leaving behind lasting damage that affects breathing. This means that even after the infection is controlled, normal lung function may never completely return. Over time, this can lead to long-term breathing difficulties and reduced physical performance in daily life. This is what makes slow infections dangerous. Not just how they spread, but how long their effects can last. But while some infections take months to damage the body, others can cause serious effects within just hours. Unlike infections that develop slowly, cholera can begin affecting the body within a very short period of time. It usually enters the body through contaminated water or food, reaching the digestive system quickly. Once inside the intestines, the bacteria begin disrupting normal fluid balance in the body almost immediately. This disruption causes the body to lose large amounts of fluid in a short period, weakening it quickly. Unlike slow infections, this process can escalate within hours. making early response extremely important. Unlike slow infections, this process can escalate within hours, making early response extremely important. As the infection develops, the body begins losing fluids rapidly through the digestive system in a short time. Dehydration can begin quickly, reducing the body's ability to function properly within a very short time. As fluid levels continue to drop, circulation and energy levels are affected, making movement more difficult. Unlike slower infections, these changes can happen within hours, leaving very little time to respond effectively. As fluid loss continues, the body becomes severely dehydrated, affecting nearly every system at once. The blood becomes more concentrated, making it harder for circulation to deliver oxygen and nutrients. As circulation weakens, the body struggles to maintain stable function, leading to increasing physical weakness. Vital systems begin to lose efficiency as dehydration continues, pushing the body closer to a critical condition. Without rapid fluid replacement, this condition can escalate quickly, leaving very little time for recovery. At this stage, the body may no longer maintain balance. As dehydration severely disrupts internal systems, movement becomes difficult, and the body may struggle to stay upright as energy levels drop significantly. Without immediate intervention, the condition can rapidly progress toward a critical and life-threatening state. However, rapid fluid replacement can stabilize the body and restore essential functions if done in time. This makes early response critical, as timely treatment can reverse the effects before permanent damage occurs. Cholera shows how quickly the body can lose balance when fluids are not properly maintained. Unlike infections that develop over weeks, this condition can become severe within just a few hours. Each type of infection affects the body differently. Some slowly, some rapidly, but all can become dangerous. The real danger often comes from how these conditions develop before the body can respond effectively. Whether fast or slow, these infections highlight how vulnerable the body can be under the right conditions. What makes these infections dangerous is not just how they work, but how easily they can go unnoticed. Many of them begin quietly, without clear warning signs that something serious is already developing. By the time symptoms appear, the infection may have already reached a stage that is harder to control. This delay between cause and effect is what makes these conditions more dangerous than they first appear. Even when the body tries to respond, it may not always react fast enough to stop the progression. In some cases, the response itself can create additional strain, adding to the overall impact on the body. This combination of hidden progression and delayed reaction is what makes these infections difficult to manage. Some spread slowly over time, while others act quickly, but both can reach dangerous levels if not addressed. The key difference is not always speed, but how early the problem is recognized and handled. And often, the most serious risks are the ones that develop before you even realize they're there. Some of the most dangerous threats are not the ones you see, but the ones already inside your body. And the most concerning part is, you may not notice them until it is already too late. If this surprised you, there are even more hidden risks around you that most people completely overlook. Watch the next video to discover what might be living on your skin right now, because some of them are closer to you than you think.